Okay, hello, good morning, good afternoon, good evening, depending on when you're watching this video. Okay, my name is Judith, and I'll be teaching the intermediate level medical students um, some simple terms in English and how to help them academically and professionally healthcare settings. So here are the list of the key topics, for general English. All right. Okay, now we're going to go into the parts of speech. So we have 9 parts of speech, which are noun, pronouns, adjective, adverb, verb, conjunction, interjection, and the rest of them. So now we are going to look into the nouns. What are the nouns? My people will always say noun is the name of a person, animal, place, or thing. So in terms of medical terminologies, nouns like disease, infection, surgery. Okay, we go to verbs. Verbs are like diagnose. What are verbs? Verbs is actually an action word or a doing word. So in medical terms, it has to do with, for example, diagnose, treat, examine. So you can be asked, what are you doing? What is the action that you are diagnosing a patient, or you want to treat a patient, or you want to examine a patient? So this is the action word. What are you actually doing? You want to treat a patient. So that's the noun there. So adjectives are what we use to qualify a noun. So how the noun is, how much is the noun? So adjective is like you're treating, but how much are you treating that thing? So how do you qualify that verb? And I say chronic. How do you qualify a noun? You use it to qualify a noun. So you can say a chronic disease, acute malaria, contagious infection. So adjective, we use adjective to qualify a noun. So an adverb are used to qualify verb. Okay, somebody can ask you, how well are you treating this person? You say gradually. You're taking your time. It's a gradual process. Okay, now we can go to the tenses in medical settings. The tenses in medical settings. Present simple tense. Present simple tense. So here we have the heart. The heart pumps blood. The heart pumps blood. Okay, now it's a present tense. It is just happening now. Okay, as you're speaking, that is what is happening. What am I doing now? I am teaching you. I am teaching you. Okay, so we're talking about what is happening now at the moment. Now we have present perfect. Present perfect. For example, the example is she has had the flu for 3 days. You're telling somebody now. Let's say you're telling your consultant what is happening. And he says, give me the report, give me the history. You'll be like, she has had the flu 3 days ago. Or the relative of the patient comes to you and say, you'll be like, what is happening? What has happened to this patient? How did it start? And the relative said she had the flu for 3 days. The baby has been coughing for 3 days. All right, they are telling you now, but it's something that had happened before. So, and it is straight to the point. So past simple. The patient was admitted last night. The patient was admitted last night. So when did this happen? Last night. So that is past simple tense. All right. And then we have future forms. future forms. The surgery will take place tomorrow. You've already booked an appointment and your chief comes up to you. What do you think will happen to this patient? You'll be like, the surgery will take place tomorrow. Or you come to read your students' history, and you know that they have been scheduled for either a surgery or a consultation or treatment. Okay, it is in the future, so you know your next move. So here we only have the example: the surgery will take place